Morning, everyone. You guys gotta listen to me and Sophia chatting for a little bit. So this is my senior lecture, Navigating Mental Health as a Physician. As most of you know me, hopefully. My name's Priscilla. So why do I want to talk about this? The past year and a half has been tumultuous. With the pandemic, with the Black Lives Matter movement, the anti-Asian attacks, the endless shootings, the insurrection, so forth and so on. I personally am still processing all my emotions regarding all these events, but during my time in residency here, I've been personally and professionally invested in physician mental health and wellness. The past year has shown us how much solidarity as a community we can have, but also has shown the cracks within the system, how many things have been band-aided for much too long, and right now we have the momentum to improve physician mental health. So let's start with some numbers. The American Foundation of Suicide Prevention estimates 300 to 400 physicians die by suicide each year. Think about it. That's 4 times our entire residency. That could be the next 12 years of resident doctors from our program gone. In August 2020, the Physicians Foundation sent a survey out to their AMA and master list, trying to assess COVID-19's impact on physician well-being. Majority said that they had feelings of burnout. 18% have increased use of meds, alcohol, illicit drugs. 8% had thoughts of self-harm. And within those 8%, younger physicians rated a higher rate of self-harm than older physicians. Also, 22% know a physician who committed suicide. 26% know a physician who considered suicide. And 15% know a physician who attempted suicide. Just this week, the week after celebrating Doctors' Day on March 30th, we lost 2 EM doctors, Dr. Brian Thomas Fletcher and Dr. Elle Kahini. So let's talk. Let's talk about the barriers that prevent doctors from getting mental health care. Second, let's talk about the advocacy and the changing culture within medicine regarding this. And third, let's talk about the hope for the future. So the common barriers for physician mental health. Let's start with something that was coined by some researchers called the physician personality. It's what makes us good doctors, but it's also a double-edged sword. We tend to be perfectionists and hard workers. We have difficulty allotting time for ourselves, and we have exaggerated sense of responsibility to our patients. We're taught to cope alone, and we become fearful of others perceiving us as weak. The imposter syndrome, which many of us have. There's also this survival mentality. Just make it through. Things will get better after residency. A study conducted showed that 37% doctors reported looking forward to retirement as a strategy for well-being. Work now, retire, and then have a personal life. A study that was published in Journal of General Medical Education that assessed the perceived barriers to mental health treatment amongst depressed interns. This was 6 academic programs and 13 community programs. They found that 52% of those interns were concerned about what others would think. 43% said that they thought their colleagues would have less confidence in them if they sought mental health treatment. Next, let's talk about the barrier of the culture within medicine, something called the hidden curriculum. It's unspoken rules and culture of medicine that we learn every day, just through everyday interactions in the hallways of the ER, the hallways of the hospital. There's an emphasis of stoicism. We're taught to minimize our feelings. We also get mixed messages to care about our wellness, but then work through our sickness. A quote. My co-resident came in with a fever. My attending called her dedicated. What's the lesson we learned? Work comes first, in front of your own health and your own illness. Second, don't show emotions because that's weakness. What's the lesson we learn? There's no crying in medicine. Within this culture, psychological problems are considered shameful. An article that came out in The Guardian last month details the fears that doctors have regarding seeking mental health care and how it is especially damaging during the times of COVID. Mary Dean was a resident in Pennsylvania during the height of COVID. And her residency program, fostered a culture where residents couldn't ask for mental health care. This is a quote from the article. She turned to her older doctors, who advised her to drive out of town, pay cash, and use a pseudonym if she needed to talk to someone. It's almost like a really shady deal just to get mental health care and some support. What she ended up doing was finding a therapist 2 hours away. ACEP really had a mental health care poll among emergency physicians that was conducted this past October 2020. These are some numbers that they found. 45% of emergency doctors feel not comfortable seeking mental health treatment. 71% say that they feel there's stigma among their colleagues. 73% say there's stigma in their workplace if they were to seek mental health treatment. 57% said that they were concerned for their job, and 27% avoided seeking mental health treatment in fear of professional repercussions. Interesting enough, a number that was found was that 71% of those doctors said that they rate their ability to access mental health treatment as excellent. So based on this, we doctors have access to care. It's just that we don't feel comfortable getting that care. Let's dive into the professional repercussions that doctors fear. Physicians can be asked questions regarding the mental health treatment, include anything from their diagnosis to their treatment to getting a peer reference. There is legitimate fear that having a mental health illness could derail their professional careers. These questions can be on their medical licensing applications, hospital credentialing, malpractice insurance, and disability insurance. Here's some medical licensing stats. In 2017, the Mayo Clinic proceedings found that 40% of physicians surveyed were reluctant to get mental health treatment for fear of interfering with renewing their medical license. An EP monthly survey in 2006, 85% who responded said that they had experienced depression, but they didn't report it to their licensing, their employers, or their credentialing authorities. Now, are these fears legitimate? Well, a study conducted in 2007 showed that 1/3 of state medical executive directors reported a diagnosis of mental health or mental illness itself was sufficient for sanctioning a physician. That's 13 out of 35 states. Dr. Pamela Whipple in 2017, I believe 2017 or 2018, she's a family doctor, a researcher, and founder of Ideal Medical Care, who started a hotline in 2012 for physicians needing confidential help, did a study along with a med student co-researcher, studying the medical licensing applications from each state, grading their approach to mental health screening questions. She gave them A through F. A was none, there was no questions on the medical licensing application, or straightforward current impairment questions. So for grade A, there's only 4 states that say no, there are no questions about mental health, and only 5 states say current impairment. She gave a grade B for those that were progressive, that were only linked to current impairment. There are 14 states that only ask questions about current impairment. Grade C was questions spanning the last 5 years. D were those for beyond 5 years or required a peer reference for the applicant's mental health. And F, and within C, there was 10 states, and within D, there were also 10 states. And F is highly invasive. These were unlinked to current impairment and contain confusing, punitive, or adversarial language. So I'm going to go over a couple of the state medical licensing questions about mental health for my class, where we're going. New York, a lot of us are staying in New York. New York is grade A. There are no mental health questions on that medical license application. For those of us going to Pennsylvania, they say it's also grade A. The only question they ask is about drug-related impairment. Grade B, considered as progressive. California, I think I'm the only one who's going to California. It links to current impairment. And New Jersey. So New Jersey has a grade B. This is their question about impairment, but they also have 2 other questions related to chemical questions. And then the last question is any diagnosis of pedophilia, exhibitionism, and voyeurism. And interesting enough, the entire section of these 4 questions is preceded with a statement about an applicant's Fifth Amendment right against self-incrimination. Oregon. It was given a grade C in this paper. 3 mental health questions, pretty extensive. For example, for grade D is DC. It's a federal district with its own medical licensing board that asks these impairment questions and 2 which are non-drug related. And grade F, Massachusetts. Previously at grade A, it used to only ask 1 straightforward question, and then it added 2 additional impairment questions related to substance use. And then in the application, there is a large, the reason why Dr. Wabel said that this was grade F was that in the application itself, there's a large box saying an important note regarding physician wellness and 4 paragraphs promoting Massachusetts Societies of Physician Health Services. There is this talking about and addressing the physician health programs is beyond the scope of this lecture, but there are proponents and opponents towards the PHP programs. And if you were to look online, there are a lot of horror stories about it. So what happens if you mark yes on your application? You say, yes, I did have a mental illness, or it doesn't currently impair me, but you're thinking, oh, there is a mental health illness diagnosis, I'm gonna mark yes. So physicians become scared that if they don't disclose, and then there's a recurrence of symptoms, they might result in the licensing board accusing them, the applicant, that they filed a false application, which could have legal consequences. Interesting enough, though, when you disclose this information is actually protected by the Americans with Disabilities Act. If you say yes, this may lead to additional questions, and the medical board may ask for access to your mental health questions. An example is Dr. Michael Myers, I asked him, what happens when this happens? Like, what happens? What goes on? So in New York, we have something which is a PHP, a physician health program. It's called the Committee for Physician Health for State of New York. When anyone could be a disgruntled patient or a colleague who's noticed that something's going on, you seem to be, they refer you to this program. Or say you took a medical leave for a year and a half for mental health reason. And your treating physician says, hey, you're good to return to work. I think this person is fit to return to work. But you were still referred to the Committee for Physician Health for State of New York, requesting the independent medical eval. There's only 5 doctors who can give you this independent medical eval within the state of New York. This person will meet with you as a physician for 3 hours and then ask you for permission to obtain collateral. So for example, as a resident, to obtain that collateral, it can include your treating psychiatrist, your psychologist, your program director, your primary care doctor, sometimes 1 to 2 peers, a family member, maybe your spouse or your partner, and then they can make a decision whether or not you are fit to return to duty. And then they send this independent medical eval to the committee, and the committee then works with the doctor and discusses it with your employer. But it doesn't end there. They can say you're fit to return to duty, or they could say, hey, we actually want to observe you for 6 weeks, or say, hey, no calls, we want to monitor you for a little longer. So as you can see, there is a lot of repercussions with marking yes, and I can only imagine as a physician, as a doctor, marking yes, this will delay your application for licensing, and that could delay your credentialing and so forth and start your job. And also having to release all this information, which is private. Now, it's not all bad news. Let's acknowledge that there are barriers, but things are changing. We have advocacy and a changing culture within medicine to address this. The Federation of State Medical Boards Work Group on Physician Wellness and Burnout released 10 recommendations regarding medical licensing questions. This was in order to balance the medical board's mission to protect patients from impaired physicians while allowing physicians to seek care without fear of their license. Within these 10 recommendations, the first was to evaluate the necessity of probing questions, differentiating illness from current impairment, and in limiting how extensive the impairment history can contain. So current impairment versus last 5 years, they recommend the last 2 years. The American Psychiatric Association says that having a psychiatric diagnosis is not an accurate predictor of mental fitness, and status questions are inappropriate and irrelevant to the question of current impairment. The AMA also supports this. So there is definitely a difference between illness versus impairment. Illness is just the existence of diagnosis of the disease. You have a diagnosis of depression, you have a diagnosis of anxiety, but does it impair you? Impairment is a functional classification defined by the AMA as an inability to practice medicine with reasonable skill and safety due to 1, mental illness, 2, physical illness, or 3, excessive use of abuse of drugs, including alcohol. The Joint Commission in May 2020, they also support the FSMB, the Federation of State Medical Boards, and AMA to limit inquiries to conditions that currently impair the clinician's ability to perform their job. That they, in their statement, said that it is critical that we ensure healthcare workers can feel free to access mental health resources. And that they say organizations are not required to ask about a clinician's history of mental health conditions or treatment. And that strongly encourage to not ask about past medical history of mental health conditions or treatment. ACEP released a statement in June 2020 that encouraging physicians to seek treatment for psychiatric symptoms, just like as anyone else could. And that the professional's history of mental illness or substance use disorder should not be used as an indicator for current or future ability to competently practice medicine. There is currently some licensing reform campaign. The American Medical Women's Association launched the Humans Before Heroes. This is supported by AMA, ACEP, and AAEM. This was launched in conjunction with the 3rd National Physician Suicide Awareness Day. As many of you guys know, there is the Dr. Lorna Breen Health Foundation. There was a Healthcare Provider Protection Act that is currently in legislature. They said that there's 4 objectives that they want to address. 1 is major steps to reduce and prevent suicide and burnout by creating behavioral health and well-being training programs. 2nd objective was support for a national campaign to encourage healthcare professionals to seek support and treatment. 3rd was a federal study into healthcare professional mental health and burnout, and grants to establish and expand mental health support services. Just this past March, or not this past March, literally last month, in the American Rescue Plan, provisions within that bill was able to have $140 million in funding for this act. I remember being a scared intern and wondering what our resources were. Intern year is tough, transitioning from 4th year to 1st year. I compiled these resources with the hope to vet them for my co-residents and distribute them as some sort of flyer. So this was the resources we had that I had to go look for. I had to go call different people, ask them. This was the official policy about how we can access psychiatric care if we needed it ourselves as residents. But things are getting better within our hospital systems on both sides. H&H had released this website that allows us to have easily accessible wellness and mental health physician resources. So that way everything's compiled. You can just click on a website and it's there. And then we also have programs at H&H that include the Healers Heal program, as well as the Battle Buddy program. And SUNY Downstate now has a website, which they did not have 4 years ago. They now have a website with resources as well as how to pay for therapy, because that's half the battle, trying to figure out, does my insurance even cover this, or do I have to pay cash? Mental health affects all of us. In an MRAV episode about resident wellness, Dr. Michelle Lynn and Dr. Chris Doty, one of our former program directors, talk about areas of improvement to prevent burnout in emergency medicine. One of these areas is to normalize the conversation about the stress of our jobs. We give us to normalize this conversation to allow us to talk about our feelings, depression, second victim syndrome, anxiety or worries about our patients, medical mistakes or getting sued, family issues, our physical exhaustion or parenting difficulties, illness in our family, financial issues. We need role models to stand up and tell us like, hey, I was feeling really depressed during residency. When I went through that lawsuit, I felt like a really bad doctor, or I've struggled with anxiety my whole career until it becomes normal. This past summer with the pandemic, many role models in emergency medicine or within medicine itself posted some tweets. And this is one step towards the right direction, normalizing that we are people too. Some hopes for the future. I'm personally invested and professionally invested in physician mental health and wellness. I hope that the advocacy of efforts are fruitful, that when someone feels down, they do not feel ashamed to say that they need help, that it'll be easy to access mental health resources without fear, that we're not penalized for asking for help. We're going in the right direction, and we will get there eventually. So that's the end of my lecture. If there's any questions regarding anything, I wanted to say some thank yous also. But any questions, comments? Dr. Willis?
Great job, Priscilla. I think it's an extremely important topic. I guess a question, and it's something I feel like is a big part of this, is that society and ourselves, I think, have such a high expectation of what it means to be a physician and who we are and what the expectations are. I guess, is there any corollaries with other occupations that I guess we get compared to sometimes, like traffic control, airline traffic control people, or people who operate like heavy, dangerous equipment? Is there any corollaries to them with like mental health, if you know?
In regards to their stigma in regards to mental health?
Well, not stigma, but like, do they get asked these questions by former employers or education? Because I feel like we're always held to this high standard, and we have these questions that get asked to us, but are there other professionals that get asked those same questions?
So lawyers do. There was an article in the American, it's like Psychiatric and Law. I forgot what the title of that journal is, but they compared, they were talking about the medical professionals and then compared it directly to lawyers. And in lawyers, their application also asks quite invasive questions as well. And there's a couple lawsuits that established, I think in Louisiana, they established that this is not right and you cannot ask these questions.
Interesting. I guess I can think of law enforcement or have psych evals.
Sure.
They get questions like that too. It's interesting.
Any other questions, comments?
Great job, Chrissy. Great job.